Time for Paging Dr. Paul. I don't know. I grew up watching Muhammad Ali and Joe Frazier, and I remember the Thriller in Manila.
I remember.
It was yesterday.
Oh yeah, that was the talk of the town.
It was when boxing was king.
Oh yeah,
and it was never been the same since.
Nope.
I don't think
it's changed.
Fantastic. I tell you what, there's a lot of people walking around, a lot of fellas walking around with hair on their lips. Movember is here, and I did it last year, and we're watching Stuntman Stu do his thing up upstairs at Magic. But this, you know, it's a lot of fun, Movember, but it comes with an important message, doesn't it?
The message is, let's be aware of cancer. You know, we're talking about prostate cancer, but let's talk about all cancers because, you know, one in three individuals, you know, look in a room, a couple of people around you will at one time of their lives either themselves have cancer or have a close family member has cancer. And we've made tremendous strides in understanding what cancer is.
Yes.
And being able to treat it and being able to pick it up early. And that's the whole point. Let's pick it up early. The earlier we pick it up, the better the chances are of survival. Our survival rates have quadrupled over the last 50 years because we know not only that we have better techniques of, you know, treating, but it's get it early, and that's the important thing.
Well, it's a combination of the two, right? We have better screening processes right now, better screening capabilities right now, but it has to go hand in hand with individuals coming in for that screening process.
Exactly.
And one of the hardest people to reach in this area, traditionally, has been men.
Exactly. Men tend to forget about it. You know,
it couldn't happen to them.
It's not going to happen to me. I'm too busy. I'm doing things. I'm traveling, etc. They need to be able to take their health seriously. They need to know that you know, aside from the multiple things that can go wrong in terms of lifestyle choices, some of the things that they do in their lives can lead to cancer.
Yes.
Smoking, for example, is the leading cause of cancer.
Right.
What you eat sometimes can prevent or not prevent cancers. So that's quite important. And what we tell people, not only for prostate cancer, but you're talking about breast cancer in women. You're talking about colorectal cancer, skin cancer, all these things that we talked about. There are screening processes, and there are things that you can do. Now, I'm not going to get into the details of it, but I think what individuals should do, especially men, go to their doctor, talk about an individualized plan for them, because certain people have higher risks. There are certain cancers that run in families, for example. Certain age groups have higher risks for certain cancers. So depending on what age group you are, depending on your family history, sit down with your healthcare professional and make a plan that's good for you. Know your body and practice healthy lifestyles. Don't smoke, exercise, and eat right.
I listened to an interesting presentation last Friday night at an event in Arnprior, and it was Dr. Lee talking about, and he's worked all over this area, talking about the digital mammography machines that are now available and how that's what they're raising funds to get out there. Certainly, technologically, there's been many advances, but I shudder to think that even women, but for men who think they don't need to get these tests, or for some reason are not comfortable with the idea.
Sure.
There are many ways to go about this, and you should really take that opportunity. And you're talking to, listen to a guy who's about to turn 50, so it makes a difference. Right?
It makes a big difference, especially when you're entering the 45, 50-year age range. We know that as you get older, cancer rates go higher, and it has to do probably with aging. You know, it's probably
simple as that.
Simple as that. So, but there are things that we can do to offset it, and the most important thing is be informed, live a healthy lifestyle, and get a plan that's good for you individually, given the context of your family history and your own personal history.
There's no question about it, Doctor. There's lots of information out there. There should be nobody claiming there's a shortage of info.
There's a plethora of information out there, and as a matter of fact, it doubles every 7 hours. It's growing at a tremendous speed. The knowledge that we have in medicine is doubling really quickly, but it's to the benefit. And we've come a long way, really. From I remember myself being in medical school, looking at what's cancer, and right now we know that we know exactly what cancer is. We've studied the genes, and we even know that viruses cause cancer now as well. So we've come a long way.
Isn't that funny that when you were in medical school, not that long ago, that we were wondering what this was all about? Unbelievable. Thank you, sir. Good to see you. All right, coming up 8:14, we'll head back to Sarah Freemark. She's enjoying herself in Carlton Place at St. James Gate. They're making up buttered chicken. They got fish and chips, which is apparently fantastic over there. Remember, fish and chips is good in moderation. We'll be right back.